For most people, mistletoe reminds them of Christmas. But besides serving as a festive holiday decoration, did you know that mistletoe is also used in herbal medicine and has been for hundreds of years? It's a little known fact that there's actually more than one type of mistletoe. In fact, it's believed that there's over 100 different mistletoe species grown around the world. A few of these are commonly harvested for their medical properties. American mistletoe is the type that grows in the United States, and it's used as a romantic holiday decoration, while European mistletoe, Viscum album in Latin, is the species that's been used for centuries in traditional herbal medicine. A third species of mistletoe, Loranthus ferruginus, is less common, but used by some to treat high blood pressure and gastrointestinal complaints. When it comes to health promotion and preventing common conditions, according to the National Centre for Complementary and Integrative Health, some of the many ailments that mistletoe may help treat include seizures, headaches, arthritis, and potentially even cancer. While it may have been considered a top herb for healing throughout history, and currently in Europe, there's not much evidence showing that it definitely works. Mistletoe burrows roots in the inner wood of a tree and feeds from their sap. A heavy infestation with mistletoe can kill branches of the host plant or even the entire host. This is one reason why mistletoe has earned a reputation as being poisonous. Once dried and made into an extract, it's typically given as an injection. It can, however, also be taken by mouth as a capsule or a supplement and consumed as a tea and a tincture. Studies have identified different kinds of free radical scavenging antioxidants, antimicrobial and anti-inflammatory constituents within various species, including flavonoids, alkaloids, polypeptides, arginine, polysaccharides, tannins, glycosides, and gallic acid. It's well known that parts of the plant, including the berries and the leaves, can cause serious side effects when consumed. Poisoning can also occur if you drink tea created from the plant or its leaves and berries. The poisonous ingredient found in mistletoe is called phototoxin. Symptoms are most likely to occur after ingesting the leaves and usually last for 1 to 3 days. There's also potential side effects associated with injections. Side effects that can be caused by mistletoe extract injections can include soreness, inflammation at the injection site, headache, fever, chills, skin rash, and rarely a severe allergic reaction. Other potential adverse reactions include vomiting, diarrhea, cramping, and even liver damage if used long term. All of that being said, mistletoe, when used as a medicine, seems to be generally safe, according to a 2018 statement published by the PDQ Initiative, Alternative and Complementary Therapies Editorial Board. Mistletoe has been used for centuries in traditional medicine and medicinally in Europe since the 1920s, but limited research exists on its effects. Most of the clinical trials focusing on mistletoe that is available has been conducted in Europe. Some trials have found evidence that mistletoe can help to improve survival or quality of life in cancer patients. Currently, in the United States, mistletoe is only used in clinical trials and not otherwise indicated for human use. Extracts are given by injection in Europe, where mistletoe is currently sold as a prescription drug, most often for cancer. Today, mistletoe extracts are the most frequently prescribed unconventional cancer therapies in Germany and some other European countries. In certain studies, it's been shown to stimulate the immune system and to kill certain cancer cells. However, these effects have mostly been observed in test tubes and not in humans. A number of in vitro studies have reported immunostimulatory, cytotoxic, and pro-apoptotic effects. Some have shown that mistletoe extract demonstrates the ability to block the formation of new vessels, cutting off the blood supply to tumours. There's some research to suggest that administering European mistletoe extract might offer help in the treatment of breast cancer, advanced pancreatic cancer, colon cancer, bladder cancer, stomach cancer, liver cancer, leukemia, lung cancer, ovarian cancer, and uterine cancer. Another potential use is reducing the side effects of cancer treatments, including chemotherapy and radiation therapy, and improving quality of life during recovery. A 2016 systematic review published in the Journal of Complementary and Alternative Medicine found that mistletoe therapy trials in cancer show a promising result in the improvement of patients' quality of life during chemotherapy and a reduction of fatigue. The review found that overall, patients reported demonstrable changes in their physical, emotional, psychosocial well-being following the mistletoe, as well as a reduction in chemotherapy side effects. There's some evidence that mistletoe has traditionally been used for hypertension and gastrointestinal complaints. This may lower the risk for blood vessel conditions, including high blood pressure and atherosclerosis, which is thickening and hardening of the arteries. A 2011 study published in Biochemistry Research International showed on rats that it had anti-hypertensive, anti-arthrogenic, and vasorelaxation effects that could potentially reduce cardiac episodes. Mistletoe can be used for bathing. You can also apply it to the skin to help treat varicose veins, ulcers on the lower legs, and eczema. Some also believe that it has pain-killing properties and can be used to help treat joint pain, like rheumatic and neuralgic pains, when it's rubbed into the skin. Mistletoe has emerged as a promising alternative therapy against mood-related conditions, including depression, anxiety, and fatigue, especially when these conditions are associated with cancer treatments. Several studies have shown that mistletoe can improve coping ability of both cancer patients and survivors. Mistletoe has been used to help manage menopause symptoms such as fatigue and trouble sleeping, and to regulate hormones when a woman experiences irregular periods. In postmenopausal women, the population most likely to suffer from osteoporosis, it may also be able to help defend against weak bones and fractures. Although not many studies have directly observed mistletoe's effect on the respiratory system, various mistletoe plant species are claimed to exert antioxidant, analgesic, anti-inflammatory, and immune stimulatory properties, making them defenders against illnesses and infections. Supplementing with mistletoe might be able to help fight off common colds, sore throats, fevers, coughs, and respiratory issues like asthma, although this hasn't been proven in many studies. To defend against respiratory issues and colds, it could be consumed as a tea, a tincture, or inhaled. The name mistletoe is believed to have been derived from the Celtic word for all heal. Records tell us there were many historical uses of mistletoe, most of which focused on healing the nervous system. Mistletoe was used to treat conditions including nervousness and anxiety, sometimes in combination with valerian root, for treating convulsions, hysteria, neuralgia, skin problems, urinary disorders, fever, and heart disease. In some traditional medical systems, mistletoe was believed to be a natural heart tonic that could strengthen the force of the heartbeat and increase the heart rate. Herbal formulas that included mistletoe, valerian, and vervain were often given for all kinds of nervous complaints caused by hormonal imbalances and fatigue. In traditional medicine systems, mistletoe was usually made into a healing tea or a tincture. Another traditional use of mistletoe berries was using them to make salve for skin problems like sores and ulcers. Use the smallest dose possible that exerts an obvious effect. Some herbalists use only 1 to 2 milliliters of extract per day in divided doses. Low doses of 1 milliliter per day are even used by some doctors as a complementary cancer treatment. Crude mistletoe fruit, or herb, used to make tea, typically to treat hypertension, is recommended at doses of 10 grams per day. Extracts are usually given by intravenous or subcutaneous injections at doses of 0.1 to 30 milligrams several times per week.